Hi, I'm Dr. Randy Tabita,
And I'm Dr. Jason Stevens.
and welcome to your Better Results Faster workshop. Purpose of this workshop is to teach you how to understand how your body works and heals, also to teach you ways you can prevent things that you might be doing that are causing your problems, what we call common bad habits.
We also want to teach you things you can do at home to help the healing process. And we want to give you a chance at the end to help others who may be struggling with health problems as well.
So before we get started, I would like to open up with a story about one of our patients named Barney. Barney, when he came in the office, just had really severe lower back pain. It was radiating down the right side of his leg. He's really having a lot of difficulty just standing, even walking back to the examination room. He did some physical therapy that did help a little bit, but wasn't able to really fix his problem. He was given medications that was supposed to help with the pain, but that really didn't help correct that or not have that pain come back a few hours after he took the medication. He did have some MRIs done that showed some disc herniations, and one of the things that they recommended was surgery. And Barney, that was not something that he wanted to do right away. He knew of some of the bad stuff that comes out of getting back surgery and wanted to try something more natural before he went into that area. So he did set some goals. Some of his goals at the beginning of his treatment, his short-term goal was just trying to relieve some of that pain. Midterm goal is just being able to stand and be able to play guitar. He did play guitar for his church, so that's something that he had to do throughout the week with rehearsal, but also Sunday morning during services. And one of the things he also enjoyed doing was running. Him and his daughter ran 5Ks, and that was something that was really important that he would be able to still continue to do that. One of the cool things, though, 3 months into Barney's treatment, when we did his second progress examination, one of the things we saw that he was in very little pain. He was sleeping a lot better. He was back to playing guitar at church. He was even exercising weekly, just at the gym, but also back to running. And one of the cool things he was able to do was run a 5K with his daughter, which was really cool. And he was continuing to play tennis. And if you look closely at his medal, he did get second place in his age group. And that was one thing that Barney focused on. He was really a great patient. He worked really hard at doing the things that we gave him. He was very good at making all of his appointments. He didn't miss, he didn't cancel, he did his exercise, his stretches. He took his supplements that we recommended, and then he really worked on some of the bad habits that was causing stress to his body. So one of the things going into this workshop is you have to understand that chiropractic is meant to be done with you, not done for you, meaning we can't do all the work on the table and then you just go beat your body up during the week and expect to get results. There's going to be things that we're going to give you along the way that'll help these areas heal, and we promise to give you 100% of our best effort with our adjustments in helping that spine and nervous system, and we expect 100% commitment on your part of doing the things that we're going to give you along the way and not missing and not canceling appointments to ensure that that healing can take place. Things that you need to know about your body. Again, the more that you understand your body, the more that you can help us in the healing process. So one thing you want to remember is you're designed to be healthy. Healthy is normal. You got to remember sick is abnormal. And that's one of the problems with healthcare is we think just because we're not sick that we're healthy. The reality is health is a sliding scale. You're either sliding towards it or away from it with everything that you do, everything you eat, you drink, every movement you make. So you want to make sure you're doing the right things that's sliding you towards health and not away from it. Your body's also smart. It's very intelligent. It knows how it needs to heal itself. Some of the pictures that I put on this slide show someone that has a cut. And remember, when you cut yourself, there's no magic solution in that Band-Aid that causes the healing. It's all on your body. So you cut yourself, the skin starts to scab. Then all of a sudden it grows back, and then you can't even tell that you got a cut. And that's all done throughout your body. The only thing the Band-Aid does is it keeps it from getting infected. One of the other things, when you're cold, you shiver. And you do that so your body can contract muscles to release heat. At no point do you have to think of a certain temperature that your body dips to in order to do that. It automatically does it. Same thing with fevers. Fevers are a good thing. It's your body's way of heating up its internal environment to kill off any of the viruses or bacteria that could be making it sick. So you got to watch. You don't want to take medication to suppress the fever because that'll actually extend the duration of the illness. So let that fever run its course. Obviously if it gets up high to 105, 106, then you need to go to the hospital. But around 102, 101, it's just doing its thing. So just trust your body. The other thing that we talk a lot about is your nervous system, and your nervous system is your master system. It's that innate intelligence that travels across the nervous system and it communicates through the body. And it's pretty much the system that helps us adapt and deal with stress. It's that flow of intelligence, of information that courses across those nerves that keeps us healthy and healing. All the tissues, organs, organ systems rely on this nerve supply to function and stay healthy. Stress, and we talk a lot about stress here in the office, and stress really causes that condition known as a subluxation, which, remember, those subluxations are blocked or damaged nerves that decrease your body's natural communication system throughout that nervous system. So one of the things you see here is the safety pins, and you can see when those safety pins are closed, your brain sends information to the body lets the brain know what it needs to keep it healing, and that's a continuous cycle. But what we do know is the brain can have a disruption of that communication, what we call a subluxation, where it's not able to send that information through the nerves to those areas of the body, and that's what we know over time that can create a lot of health issues. We talk about stress, and unfortunately with life, it's unnaturally stressful, and stress is broken down into 3 different states. You have your mental, emotional, your chemical, and your physical. Mental, emotional, a lot of us like to think of watching TV, unfortunately, with the news. We got a lot of bad information there that causes a lot of stress and really gets the blood pressure going. You talk about family life that can be stressful, work, that can be stressful. Then there's also chemical stressors, and this is things that you might eat. You got to remember that a lot of those foods that are grown outside are sprayed with some dangerous chemicals that will kill off bugs and weeds. But if you don't scrub it well, that's something you ingest, and that can actually cause some chemical subluxations in through your body. Bad air, even some of the stuff you clean your house with, and even plastics, things that aren't supposed to be recycled, that you might continuously fill water in a plastic water bottle. If it's not BPA free, then that's something that can cause some toxicity through your nervous system. Physical stressors is a big one, and that's when we look at what we call macro stressors, which are big stressors like trauma. And this can be falls, this could be sports injuries, car accidents, or even the birthing process. And I don't know if you guys have seen yet, when the babies are born, their parents bring them in so they can get checked to see if they have a subluxation. Usually that first subluxation occurs at birth. There's a lot of pulling and twisting to get the baby out, and that will usually subluxate the top of their neck, which can cause a lot of health issues and slow down their development. The bigger stressors we do see are what we call microstressors or bad habits. Now this is more of a repetitive stress, things that you do frequently throughout the day, things like looking at your phone, being on your computer. No one has perfect posture all day when they're on their computer, but you start to lean forward. Another thing is sleeping habits. So you got to make sure you're not putting too much stress on your body by sleeping in weird positions. Posture plays a huge role in that as well too. So the average head weighs about 12 pounds. For every inch that your head goes forward with gravity pushing, adds about 10 pounds of weight to your skull. So the picture at the bottom shows someone with 2 inches of forward head carriage, which is now causing their neck muscles and their shoulder muscles to support 32 pounds instead of 12 pounds. So what we typically see is those people will have muscle pain and through their neck and shoulders, headaches. And the problem isn't that they need a medication. The problem is they got to fix their posture. So that's one thing that we'll look at. One thing we know is that stress happens and builds up through the body, and that's a cumulative effect. It doesn't just happen overnight, but doing the same things over and over again for years that really cause this breakdown. So what we know with that stress, it causes those subluxations, which create interference in the nerve system. Subluxations cause a breakdown in communication. This causes joint tissue inflammation, irritation, more stress, and it just triggers into a downward spiral. So, we all go through this when we're sitting for long periods of time, staring at computers. Your shoulders get sore, your muscles get sore in your neck. Maybe the next day it feels a little bit worse. And, that stuff builds in through the days until eventually that overwhelms that nervous system where it's unable to really get the healing to take place that it needs to. As we know with these subluxations, it's going to affect that information that flows across the nerves, and that's what keeps our organs working properly. Almost like wires in a home. Nerves go to specific organs, they have specific functions, and any interference to those areas creates dysfunction in the organ. In other words, that organ does not work right. This is a subluxation, and subluxations are very often the cause of disease and can rob you of your health in your life. And the thing about subluxations, they typically start silently. You don't feel a subluxation. What you eventually feel is the effects that subluxation has on your body.
So the next question is, how do you know if you have subluxations? And what you see on the screen here is really how we tell. It's the same way you know if you have high blood pressure or if you have high cholesterol or high blood sugar. You need to have it tested, and that's really what we do in the office to really tell if you have subluxations. That's the only way we know to really tell if you have subluxations, is to have it tested, and that's why we do all the tests and scans that we do when you're first in the office. That's why we do the bilateral scales, not because we want to know how much you weigh, but we want to know how out of balance your body is. That's why we check your posture. That's why we do the nutrition scan and all the nervous system scans, so we can really see exactly what is going on with your nervous system and what we really need to do to get your body healthy going forward. So what do you do to correct subluxation then? You have to take action. It's really important to take action to really make changes. You can't keep doing the same things over and over and expect different results. We got to take action to really make those changes. So we break our action steps down into what we call our four-legged stool of results. So these are 4 things that we feel like if you do these on a consistent basis over time, that's where the results really live. We see people really get the best results when they're doing these 4 things consistently over time. So the 4 things we really talk about are adjustments in rhythm, corrective exercises, proper nutrition, and breaking your bad habits. So let's take a minute here to kind of dive into these and talk about these 4 things. So number 1 is adjustments in rhythm. We talk about rhythm because rhythm and consistency with appointments early on is really important to build that momentum. Early on, care is a lot of 3 steps forward, 2 steps back, 3 steps forward, 2 steps back. And what we want it to be is 3 steps forward, 1 step back, or 3 steps forward, no steps back. So if you mess with that rhythm and consistency with appointments, it really changes that, and it might be 3 steps forward, 3 steps back, where you're not really seeing the changes that you would like to see. So twice a week means twice a week. If you do need to miss or cancel an appointment because life comes up, we have a 24-hour rule where you need to make that appointment up within the next 24 hours, or especially within that week, to really keep that rhythm and momentum going. If you're going to be on vacation, add extra visits before and after your vacation. That way you can keep that consistency and rhythm and not slide back while you are away on vacation. And make up your missed appointments. You do need to miss an appointment. Make sure you're making those up. It's really critical to keep that rhythm and consistency with your adjustments early on to get the results. So we break our care down into different stages. You have initial intensive care, where we're going to stop the damage that's been occurring, really just start that healing process. After we progress through initial intensive care, we talk about corrective care. Corrective care is about strengthening, stabilizing your spine and nervous system so that you can be active and do what you need to do and not just relapse every time you use your body. And then wellness care is about maintaining that new level of optimal health so that you have energy and vitality to really live the life you want to live and do the things you want to do. So I talked about it earlier, but that rhythm and consistency, extremely important to really get this momentum changing initially with initial intensive care. But the most important phase of care is probably corrective care, where you strengthen and stabilize. That's where we really start to see more permanent changes, rather than just feeling better and then having this red line happen where you slowly lose ground over time. Corrective care is so important to really stabilize things going forward for you too. So the second leg of the 4-legged stool of results is breaking bad habits. It can be something as simple as watching your posture, drinking more water, moving your body, getting exercise, getting proper amount of rest, making sure you're getting the sleep that your body needs to really recover and repair and heal through this process too. So with this presentation, there is a link where you can click on that link and it'll have our bad habits sheet. It takes you through different habits that you can work on. What we want you to do is choose one of those habits. Make it a habit for you. It takes 21 days to make a habit, so make it a habit, and then you can progress on to the next one. We don't want you working on a bunch of them all at once, because what we usually see happens if you do too many things at one time is you won't do any of them. So choose one, make that a habit going forward, and then you can progress to work on the next one. And if you have questions of which one you should do, or which one would be best for you, certainly make sure you ask us and we can help you through that as well. The third leg of the four-legged stool of results is exercise. So we're going to have some stretches for you to do to help loosen tight muscles. We also have some exercises for you to do to strengthen some of the weak muscles that help stabilize your spine. So again, on the back of that bad habit sheet, I talked about the link below. There'll be some exercises we want you to incorporate into your regular routine too. So again, these exercises are good, but if you're not doing them, they're not going to help strengthen your spine and stabilize your nervous system. So it's really important you incorporate these into your program to really get the best results going forward. And the last leg of the stool of results is nutrition. If you're not feeding your body the proper nutrition that it needs, your body's not going to heal, not going to recover the way it's supposed to. So nutrition is extremely important for that healing process. So you can see here we have a simple thing we talk about: eat less crap, which is carbonated drinks, refined sugars, artificial sweeteners, processed foods, and eat more foods. And food stands for fruits and veggies, organic lean protein, omega-3 fats, and drink more water. Your doctor probably also recommended some supplements for you, so make sure you're taking those supplements on a regular basis. It's going to be important that you're feeding your body the right things to help that healing process continue and progress the way it's supposed to going forward too. So, the other part of what we talk about is healing as a process. You know, this isn't a event, this is a process. So healing takes time. So we know you're set up on a schedule, and that schedule is given to you for a reason, based off the scans and the tests that we did, and based off your health goals that you've set out. So make sure you're giving it time and putting the effort and work in to really get the most out of your care as you progress going forward too. One other thing I always mention is continuing education. You know, as chiropractors, we're required to get continuing education, and we kind of expect the same from our patients. We hold monthly workshops in the office where we educate you on a wide range of health topics, so that you can continue to learn and improve your health. So our expectation is within the first 6 months of care that you choose at least 2 of those classes that you would like to attend to come out and continue to learn more about your health and ways you can improve your health. So we also included a link below with our upcoming classes that we have. So make sure you take a look at it, plan your schedule so that you can come to some of those classes and really continue to learn how you can make yourself even healthier going forward. The last person I want to talk about is Jack. When Jack first came in, he was 5 years old, really struggling with sinus and allergy issues. So much so that his mom would watch the weather app on her phone, and if the pollen count was moderate to high for the day, Jack wasn't allowed to go outside. So put yourself in his mom's shoes. You know, as a mom of a 5-year-old, try explaining pollen to your kid. Try explaining, no, you can't go outside on this beautiful day because there's pollen in the air. She was really struggling, but Jack was really having health issues from sinus and allergy stuff that would really set him up for sinus infections and causing lots of other health issues, and was on a bunch of antibiotics at this point, so many antibiotics that he had started to form a hole in his sinus cavity. So we really had our work cut out for us with Jack, but we saw some awesome changes. Went over a year without a sick visit to the pediatrician, was able to recover from colds quicker, and his mom said he was more pleasant to be around, and had some unexpected behavioral changes, was behaving better, which when you're feeling better, it's much easier to behave better. So again, more things that chiropractic can benefit other than just neck and back pain. So it's really about improving your health overall, making sure your body's as healthy as possible. So last thing I want to mention is how you can help others through this health journey. So if you haven't taken advantage of the free family checkup, make sure you do that. If you have immediate family you'd like to see get into care, you have your first 30 days under care to get them in, and we'll give them a free first visit. That's all the scans, consultation with the doctor. So make sure you get your family and get them checked. Anyone else you know, whether it's friends, co-workers, people from your church, if they're having health issues and you'd like to see them, make sure they get healthy. We have a special for them as well too. Normally all those tests and scans are $145. We're offering it today for $55, so a big discount off our regular price. So if you do want to get them in, make sure you take action on that too. Don't procrastinate. Don't let them put their health off. Make sure they get set up and scheduled. So I appreciate you taking the time to listen to this. Again, if you don't take action, we're not going to see changes. So it's really important that you do take action going forward and put these into steps into action so that you can really improve your health. So have a great day.